Question: a laborer was working in the field in the afternoon of a hot summer and suddenly this person is collapsed. Which of the following is not seen? So you need to identify which of them is not associated with this condition, and if you have marked option D as the answer, that is sweating, then you are absolutely right. So you need to identify the two conditions which can be associated in this question, that is whether it is heat exhaustion or it is heat stroke. So basically in both of them there is going to be exposure to the extremes of the hot sun, and in heat exhaustion the person is not going to have any loss of consciousness or any altered sensorium, but the patients are going to have a little bit of feeling of weakness or fatigue. Whereas in the case of heat stroke, as you can see here, the person, they are going to have dizziness, loss of consciousness, and even if the patients are not treated, they can also land up into coma. Okay, so these are the points. So from these we can differentiate that yes, in this question, because the patient has collapsed, we can attribute this to heat stroke. So the patient has got heat stroke. So now let us see few points about the heat stroke. This is taken from New England Journal of Medicine. So as you can see, when there is exposure to the excess of the heat, then basically there will be increased BMR, basal metabolic rate will increase, and thereby the core body temperature will increase. And in the initial phases, the body will try to compensate this increased heat in the form of sweating, increased sweating. This is incompensable state. When there is a possibility of compensation, there is going to be a sweating initial stages of the heat stroke. But as this progresses, what happens is there is going to be increased heart rate, that is tachycardia will be there. Tachycardia will be there, and thereby there is going to be increased cardiac output, and thereby there is going to be a redistribution of the blood flow more so towards the skin rather than the viscera. Now the next step is going to take place, which is non-compensable phase, whereby ultimately it is going to land up into heat stroke. But in between, what steps we are going to have? There is going to be decreased CVP, central venous pressure will reduce, and this will in turn lead to even more and more increase in the core body temperature, and ultimately what will happen is the visceral blood flow will even more reduce, and thereby there is going to be central nervous system dysfunction, and that is the reason why there can be disorientation in these patients. And not only that, because of this increased core body temperature, the skin of these patients is going to be extremely hot skin will be there, and yes, ultimately it is going to land up into heat stroke. But in this non-compensable phase, the patients are not going to have any sweating, no sweating. So in the heat stroke, in the compensable phase, we have seen that yes, sweating can happen, but as the patient goes more and more towards non-compensable phase, this sweating will completely reduce and there will not be any sweating whatsoever. Only that patient's temperature, body temperature is going to be very, very high. So what we need to do, we need to treat these patients immediately, and the best and effective method to treat them is just use ice water and immerse their body in ice water, or we can also give cool IV crystalloids. Whatever measures we take, we should try to reduce the skin temperature. The core body temperature will also reduce. So this is what is heat stroke. I hope all of you enjoyed this video. If you have understood the explanation, if it was helpful, please do hit that like button.